Hi friends, welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time to spending here to learn something new today. Today we will discussing about introduction to UB4 claim form in medical billing. UB4 claim form is also known as a CMS 1450 claim form, and the UB4 claim form uh, is also known as a hospital billing claim form, and also we can call it as a institutional billing claim form. CMS 1500 claim form compared to UB4, the CMS 1500 claim form is also known as a professional billing claim form, is also known as a physician billing. But UB4 claim form is known as a hospitalization billing, or otherwise it's called as a hospital billing, or otherwise it is known as a institutional billing. You know, Before that, you have to understand that UB4 claim form billing and UB4 claim form coding and also insurance payment reimbursements to the doctors is also different. The billing, the design, the coding, and also insurance payments to the doctors is different in a UB4 claim form compared to CMS 1500 claim form. But you have to understand one point: the denial management. If you are working as a AR caller, for example, you are submitting a claim to insurance will process the claim. For example, consider that it is a denied, the claim is denied to your doctor. The denial code is given by the insurance, right? So that denial, based on denial, as a AR caller you have to work. Generally this process is known as a AR denial management. There is a denial code on your respective denied UOB. Based on that you should have to analyze, and based on that you should have to do corrections if it is required. Again you should have to bill to the claim. So this process we can call it as a AR denial management. See, generally what I'm telling, why this concept is here, nothing but, as a AR caller you have to understand that the denial management for the UB4 claim form and the denial management for the CMS 1500 claim form is the same. See, the denial codes also same, but the thing is you have to understand that the payment weightage, how the insurance is giving the payments to your doctor, that is different. Why? Because we are billing UB4 claim form to the insurances, because the service which is given by the doctor is not like only outpatient services. So they are billing to the inpatient services to the insurances. Inpatient nothing but there is a high dollar amounts, and also why high dollar amount on this inpatient claims means the patient got hospitalized. The patient in the hospital for a week or for a month, sometime it is required, but for a week minimum, or for 3 days, for 2 days, because he is an inpatient is nothing but the patient who is staying in the hospital more than 24 hours. So that kind of services we are billing to the insurances in UB4 claim form. So we have to understand that the payment structure totally different compared to the CMS 1500 claim form, because CMS 1500 claim form we are billing to the insurances only outpatient services. Coming to UB4 claim form, we are billing to the insurances outpatient services as well as inpatient services. But here the major difference is, if you are billing a claim to insurances for the inpatient services, the payment structure is different in a UB4 claim form. That I will discuss now, and this is introduction about UB4 claim form. In next videos I will discuss about what is the real difference in payment, how the payment calculated in a inpatient claims, we will discuss clearly. Okay guys, here UB4 is a medical claim form used by institutional healthcare providers. Here institutional healthcare providers are nothing but either might be hospital, nursing homes, rural health clinics, rehabilitation centers, chronic dialysis, adult day healthcare, and some other healthcare facilities. So here, UB4 claim form is used to submit billing information for inpatient and as well as outpatient services to the insurances. So generally, we all of you know that CMS 1500 claim form. nothing but our physician or professional claim form, is used to bill only outpatient services to the insurances, right? So the doctors, the professional doctors, nothing but on CMS 1500 service based doctors, billing is only outpatient service billing. But compared to the UB4, and coming to the UB4, complete billing is not only outpatient, inpatient services will be given to the insurances. Why we are talking about inpatient? Because UB4 claim form, we all of you know that it is known as hospital billing. Why it is called hospital billing is nothing but the patient is hospitalized to take the service from the doctor. For example, you are went to the hospital, but after discussion with your doctor, you know, decision is taken to the surgery. Doctor is telling that you should have to admitted to the hospital for a week during the surgery and after the post of this surgery. At the time you are, for example, I'm telling you are admitted as a patient to the hospital for a week. So to bill that kind of services to the insurances, we are using UB4 claim forms. See that service is called as a inpatient because you are admitted hospital more than 24 hours, you will be called as a inpatient. So for that kind of services, we are billing to the insurances by using this UB4 claim form. So UB4 claim form is also known as a CMS 1450 medical claim form. This is very important because some other interview questions, if you are trying for a job, the interview questions, like they will ask what is CMS 1450. To confuse you, you have to understand that UB4 is also known as a CMS 1450 claim form. So here CMS 1450 is also known as an institution billing claim form or hospital billing claim form. But coming to CMS 1500 claim form is also known as a professional billing claim form, also known as a physician billing claim form. And UB4 medical claim form billing is also known as a hospital and institution billing, we already discussed now. The next point is UB4 developed by a CMS and approved by or published by NUBC. And here CMS abbreviation is I given like Centers for Medicare and Medicaid Services. And UB also stand for Uniform Billing, and NUBC is stand for National Uniform Claim, I mean National Uniform Billing Committee. And here the next point I given is UB4 forms are maintained by NUCC, National Uniform Claim Committee. NUCC stand for National Uniform Claim Committee, and AMA, American Medical Association, maintains the medical procedure code set. See, we are billing to the insurances in the form of procedure codes, right? These procedures are maintained by the American Medical Association. And we have to again, I am repeating that, UB4 is developed by CMS, approved or published by NUBC, and maintained by NUCC, and procedure code set is maintained by the AMA. So, and finally I want to add here in this slide, the UB4 claim form contains 81 locators or fields, or someone called as field locators also. So actually is known as a FL. UB4 claim form totally have 31 boxes. These boxes generally called as a locators or fields. So we all of you know that CMS 1500 claim form, professional claim form, have 33 boxes. The 33 boxes, total 33 boxes we are billing to the insurances. Here 81 boxes are there on UB4 claim form. We have to bill the boxes, required boxes on UB4, and we have to bill the claim to the insurances to get the payments to the doctors. So whereas I given like abbreviations, right? UB, CMS, NUCC and NUBC and AMA. Please have a look into this and go through. And here UB4 uses revenue codes. Revenue codes are defined by the National Uniform Billing Committee. Revenue codes are represented by 4 digits, with the first digit being 0. Revenue codes used to report equipment, services, and their supplies on hospital bills. See, if you want to report, generally, why I'm telling these points is, we are billing hospitalized claim form to the insurance. So how the insurance will understand what kind of equipments in a hospital used by a doctor to give the treatment to the patient. That kind of understanding is given by adding this revenue codes to the claim form. If you are billing revenue codes, they are nothing but indirectly you are telling to, I mean directly, not indirect, sorry for that, it directly you are telling to the insurance that we are using this kind of equipment or this kind of supplies in a hospital. So revenue codes identify specific accommodations, ancillary services, unique billing calculations, and claim relevant arrangements. For example, if a blood transfusion performed in the emergency room, we use revenue code 0450. See, we already know that revenue codes are 4 digit codes, and the first digit being be 0. So here first example I given, if the blood transfusion performed in emergency room, might use the revenue code 0450. And if the blood transfusion performed in the treatment room might use the revenue code 0761. See, the example 1 and example 2, the treatment is same, but the room is different. So if the room is different, we are changing the codes also. So here that code is telling to the insurance that we are using particular type of equipments, because in emergency room one kind of equipment is there is a emergency tools, but in treatment room there is not a emergency tools is available, right? For example, because in treatment room what kind of tools are required to make the treatment, that kind of tools are there. So here tool set is different. That is why we are giving codes, so that insurance will understand, okay, the transfusion performed in a emergency room. So by seeing the code of 0450, if there is a 0761, the insurance is understand that if you are billing UB4 claim form with the revenue code 0761, the insurance is understand that, yeah, blood transfusion performed by the doctor in a treatment room. So based on the revenue code, the insurance will understand on which room the treatment is given. So and also I given third example, 0490 revenue code is for ambulatory surgical care that is not covered by other categories. See, I want to add one small point. What is mean by ambulatory care? Generally for the clarification, I am telling ambulatory care is nothing but the service which is given in a day, or here surgical care, why we are mentioning, the surgery is done in a day, not like inpatient. Here ambulatory surgical cares is nothing but outpatient services. So we have a doubt, since it is outpatient, why we are using on UB4. So for clarity, again I'm repeating, UB4 claim form is used to bill the both inpatient and outpatient services. But compared to CMS 1500 claim form, UB4 claim form we are using both, but in CMS 1500 claim form we can use only outpatient services. So that is what you have to understand. Ambulatory services nothing but it is not the service given in the ambulance, it is the service given within a day. For example, you went hospital, you taken some small surgery, you went home again on the same day, then it is also called as a ambulatory care. For example, that is also surgery you taken right in a day, that is called, it is called as a ambulatory surgery. So simple, I am telling, if the patient is not hospitalized in a hospital and if you take any service from the doctor is called as a ambulatory care. So your patient is not inpatient. Inpatient is nothing but the patient who is admitted in a hospital more than 24 hours is a inpatient. So apart from inpatient services, the day services is called as a ambulatory care services. Okay guys, here UB4 forms uses HIPPICS or HIPS codes. You know, HCPCS codes or HIPPS codes are used on UB4 claim form while you are submitting claim to insurance. You know, the treatment or the service is given by the doctor to the patient will be represented in a HCPCS codes or HIPPS codes. So coming to CMS 1500 claim form, I mean, we are submitting to the insurances the service in the form of CPT or procedure codes, CPT codes. But on UB4 claim form, we can know that procedure as a HCPCS. Whereas HCPCS stand for Healthcare Common Procedure Coding System and is used to describe drugs, supplies, services that are not included in the CPT code. Here, HCPCS codes are alphanumeric and have 5 characters. So, you know, on CMS 1500 claim form, CPT codes are using. At the time that will not describe about supplies, that not describe more about the equipment whatever the used on a CMS 1500 claim form, because they doesn't require that much more equipments on a professional billing. But come to hospital billing, there is a supplies, there is a equipments, there is a more drugs compared to CPT. So here HCPCS is like having more description compared to the CPTs. Here, you know, these are the 5 character codes, alphanumeric codes. You know, I given one example, HCPCS code 90716. Here, the description of this 90716 HCPCS code is used by the coders to indicate the administration of the chickenpox or varicella vaccine. So here the vaccine or chickenpox, that kind of code is description for the 90716. This is the example for HCPCS code. Come to HCPCS code of, I mean HCPCS code R0075. Example 2 I given because these are alphanumeric codes. So here it is starting with R as in here radiology. So used by coders, R0075 code is used by coders to indicate the transportation of a portable X-ray equipment and personal to homes or nursing homes when more than one patient is served. See, generally you have to understand that HCPCS codes are used on UB4 claim form while billing to the insurances. On CMS 1500 claim form, we are using CPT codes. Here HCPCS codes, you know, it's nothing but more description or more explanation about what kind of equipment we are used, what kind of supplies we are used. That is only the difference. And come to HIPPS code stands for Health Insurance Prospective Payment System and used by healthcare insurers to make the payments determinations. So this is like, you know, HIPPS codes are just based on payment system. You know, we all of you know, right? If you are billing claim to insurance, insurance will process, adjudicate the claim, and after that it will, for example, it will process towards the payment. That payment is depends, that payments is depends on the service, that payments is depends on the procedures what we bill to the insurance. That kind of payment system will be coming to the HIPPS code. Example, I given HIPPS code 0023 indicate that the billing is for service under the home health prospective payment system here. And also I given one note point here. On institutional claims, the payments based on DRG weightage. DRG is standing for diagnosis related group. Again, I'm telling it's a very important, diagnosis related group weightage. So I would like to tell small concept. For example, here UB4 claim for we are submitting claim to both inpatient outpatient. If you are a billing claim to outpatient, we all of you know that insurance will process the claim, giving the payments to doctor as per provider fee schedule. See, based on the procedure, there is a fee schedule already allocated by the insurance. If you are a billing, for example, I am telling outpatient services. If you are a billing outpatient services, ENM code, for example, that evaluation and management code, whatever the we are billing to the insurance, it's telling that it is an outpatient service. That kind of payment is given based on the fee schedule of the insurance and doctor agreements. So for the ENM code, how much balance you build, the insurance will allow fixed amount for that ENM code as per the payer's fee schedule. So that contract also doctor signs to the insurance. So what I'm telling here, the point is, if you are billing outpatient services to the insurances will give the payments based on contract rate, based on the provider fee schedule contract rate outpatient services. But but in institutional billing or in hospital billing, we all of you know that generally patient got hospitalized. If the patient got hospitalized, we are telling that our patient is inpatient, we are giving the services for this patient as a inpatient for a week. So if you are inpatient, how the insurance will understanding means based on your diagnosis codes. Especially your there are multiple diagnosis codes we are billing to the insurances, but there is a primary diagnosis code, and associated to the primary diagnosis code there are some other diagnosis codes, they are related to the primary diagnosis codes. The diagnosis code which are related to the primary diagnosis code for the inpatient services is known as a diagnosis related group codes. Insurance will give the payments to the doctor for the inpatient services based on the DRG weightage, based on the diagnosis whatever we bill to the insurances, that kind of related diagnosis weightage, the doctor is, get the payment from the insurance. So simple, what I'm telling is, for the inpatient services on UB4 claim form, if you are billing to the insurances will give the payments based on the diagnosis weightage rate. There is some code is there, DRG. As example, I'm telling this doctor is paid for this inpatient services based on the DRG 547. So based on DRG 637, we are giving the payments for the inpatient services to this doctor. So what I'm telling, based on diagnosis weightage, the doctor will get payments from the insurance companies on institutional claim forms for inpatient services. You have to note this point. Hi friends, if you know the answer, and like if you know the abbreviation for HIPAA and PHI, could you please do comment to the video with your answer, so that it will reach us many more needy people who are searching or who are looking for this kind of content. Guys, if you are watching my video first time, if you not yet subscribed, could you please subscribe our channel PKR Vibes Career and Growth, and hit the bell icon so that you will get every my video as a notifications to your mobile. Also, if you felt content is useful, could you please like our video so that it will reach us many more needy people. And really, thank you so much for your time. Thank you for watching. Have a good health. Bye for now.